Hello, I'm Dr. Ruth Williams, a consultant children's neurologist at the Evelina London Children's Hospital. I also work as a medical examiner based at St Thomas's and cover the boroughs of Lambeth and Southwark, which have a combined population of approximately 650,000. Medical examiners are senior doctors from a range of specialties who work independently of hospitals and other healthcare providers. We review the medical records of those who've died which do not require coronial investigation and where we're not involved in the care. We come to our own conclusion about the cause of death. We then discuss the treating team's proposed cause of death with them and may advise on referral to the coroner or wording of the MCCD, the Medical Certificate of Cause of Death, also commonly known as the death certificate. Most importantly, we then contact the deceased next of kin. The legislation followed a number of inquiries and reviews, including the Shipman inquiry in 2007. Currently, and up until September the 9th, the doctor responsible for a patient's care during their final illness completes the MCCD. Registrars check the MCCD, and if the family provide additional information meeting criteria for referral, can raise their concerns directly to the coroner. The Shipman inquiry concluded that this system did not provide adequate safeguards against the rare possibility that the doctor completing the MCCD was also responsible in some way for a patient's death. The new legislation becomes statutory on the 9th of September 2024. All deaths not referred to a coroner must now be scrutinised by a medical examiner and the cause of death agreed. New MCCDs will be signed by the medical examiner to confirm that such scrutiny has taken place. The medical examiner will liaise with families to ensure that any concerns they may have are raised appropriately. Any doctor who has treated the patient at any time will be able to complete the MCCD if they are able to propose a cause of death to the best of their knowledge and belief, and there is no requirement for coronial referral.
Hello, I'm Dr. Charles Majude, consultant HIV physician at Lewisham and Greenwich NHS Trust. I'm the lead medical examiner for Lewisham and Greenwich boroughs, which covers approximately a population of 600,000. South East London has taken an integrated team approach to developing our medical examiner services. This approach allows us to have easy access to the relevant information related to a patient, removing the bureaucracy. To support this, we have in place a data sharing agreement with our primary care colleagues. This allows the medical examiner to access medical records and scrutinize the care provided prior to death. One of the benefits of a systems approach means that where a patient is resident in one of our boroughs but dies in another, details surrounding their death can be handled by the medical examiner office in the borough in which the death occurred. For example, where coroner referral is needed, the medical examiner can process this instead of the GP. This approach also means that GP practices will simply have one regular medical examiner service to refer cases to. There's no change to the way the practice will hear about a death in the community. Most are communicated from relatives or friends of the bereaved, others from the out-of-hours GP service or community nurses, or the practice may receive a notification of death. Each medical examiner's office has a dedicated email address to submit the medical examiner's referral form. Once the referral form has been received, the medical examiner will access the deceased patient's notes and perform the scrutiny. They will liaise with the deceased family or family representative, as well as interact with the attending practitioner to come up with a proposed cause of death. Discussion with the GP will normally be done via email in most of the cases. Then the ME will either agree with the GP's proposed cause of death, suggest a modification of the proposed cause of death, or refer to the coroner as required. There's no change to the general practitioner's legal duty to complete the death certificate. There are additional steps in the process, but they should not cause undue delays for the bereaved. We aim to complete the review within 24 hours. The final certificates are sent electronically to the local registrar to enable the death to be registered.
Hello, I'm Yasmin Kapadia, Consultant in Emergency Medicine at King's College Hospital NHS Trust. I'm the lead medical examiner for the service covering Bromley and Bexley boroughs, with a population of approximately 600,000. In South East London, we have established processes for urgent cases, including those of faith and paediatric deaths, where there is an expected repatriation abroad. The death must be natural, non-suspicious, and both family and attending clinician have no concerns. Also, there must be an expected cause of death, apparent and known to the attending clinician. If these conditions are not met, an expedited death certificate cannot be issued, and the next of kin will be informed of this. From September the 9th, 2024, if an attending clinician has treated the deceased at any point in the patient's life, the clinician can complete the death certificate if they are comfortable doing so. Where the attending clinician has never treated the deceased and a death certificate is required urgently or for faith reasons, this must be flagged to the medical examiner in the referral. In this circumstance, the medical examiner may complete a death certificate, an ME-MCCD, but only with the agreement of the coroner. For deaths out of hours, including weekends and bank holidays, there is a medical examiner on call each morning. The medical examiner for the relevant borough can scrutinise the case in real time and discuss the case with the next of kin. The next of kin will then be advised to contact their registrar for an urgent appointment, which are available in the mornings at weekends and bank holidays. The full document on how to contact the offices at opening times on weekends and bank holidays is on the South East London ICB website.
Hello, I am Fiona Leacock, the Associate Director for Quality and Patient Safety at South East London ICB. Patient safety is one vital aspect of quality and is aimed at minimising the risk of errors and learning from when things go wrong. To ensure that we become a learning organisation, there are a number of processes in place for reporting concerns and issues and for assessing and proposing improvements. One of these processes is open reporting of patient safety incidents. In South East London, we use an electronic quality alert system which allows GPs to report concerns that relate to the safe delivery of patient care. This information is collated and analysed by the quality team, and close monitoring of key themes, concerns and arising trends allow for any cluster of reported unexpected deaths to be quickly identified and appropriate actions taken. GPs can access the quality alert form via the ICB website.